Good morning. I'm Dr. Barb Brady with Inspiring Dreams Network. We're very excited today to have with us Tiffany Pittman, who is the School Mental Health Coordinator out of the Marshall University Technical Assistance Center with the Marshall University School of Medicine. She has lots more I guess, departments that are engaged with that, and I'll let her more thoroughly introduce herself. But I'm very excited to bring Tiffany to you today to talk about the Expanded School Mental Health Initiative in West Virginia. It was just starting when I started my career at the State Department of Education in 2007. And so Tiffany and I were able to be on the team that created Expanded School Mental Health, visiting other states and looking at what they're doing to support student mental health in schools. And it's so exciting that here, about 15 years later, that it's implemented in many schools throughout the state, and it has impacted the mental health of youth in West Virginia tremendously. So without further ado, Tiffany, take it over.
Well, happy lunch, folks. So it's good to be with you today. As Barb mentioned, we've been working together for over a decade for school mental health for West Virginia. So I'm going to jump right in. We're pretty casual. You can ask questions in chat and we'll have a conversation at the end. So West Virginia Expanded School Mental Health, it's, as you can see on the screen, a collaboration between school personnel, mental health providers, school-based health centers, community partners, that includes parents and families, and many, many more, faith-based. A whole lot of folks jump in to make life better for their communities. Okay, there we go. So this is me. As you'll see, I have the alphabet soup behind my name. And as Barb had mentioned, I'm with the Marshall University School Health Technical Assistance Center. We're happy it was around long before me. They celebrated, let's see, I think we're celebrating 27 or 28 years of support from the School of Medicine for West Virginia rural communities. Here we go. So our objectives today are to increase understanding of the West Virginia's Expanded School Mental Health Framework, learn where ESMH exists, and learn how you can help students benefit from this in your area. If it doesn't already exist, I know that there will be more opportunities upcoming because it's written into the state strategic plan. And I'm sorry, it keeps making those funky noises. All right. So school mental health, or expanded school mental health, is synonymous with the multi-tiered systems of support, or from the West Virginia Department of Education website, the West Virginia Tiered System of Support. It refers to programs that build upon the core services typically provided by schools. It's a 3-tiered framework, as I already said, and it provides the full continuum of mental health services. So we're talking, and I'll go into this a little bit more, but prevention, early intervention, and treatment. And like I said, I'll give some details in a sec. So included in the West Virginia Tiered System of Support, you can find that actually on the WVDE website. And it's pretty much a full integration. It's pretty synonymous, and I'll leave that there so that you can research that later. But if you have questions, I'm glad to direct you there. There are multiple funding sources for expanded school mental health. Some sites, some schools are self-funding. There are grant funds, there are federal funds, and there are some philanthropic organizations across West Virginia that can help impact in certain areas. It can be sustainable through collaboration. It is not always sustainable. It depends on how you set it up. It's very flexible. So what is expanded school mental health, folks ask? Well, it serves all students and staff in a school, and that's the universal prevention level. So you'll see down there, it says 80 to 90% of students benefit. And what that means is that 80 to 90% of students are successful at the universal level. And when you think about universal implementation, schools are already required to do some of this work through policy. So think about substance use prevention, suicide prevention, mental health wellness. If you've heard of PBIS, positive behavior interventions and supports, or you've heard of Second Step for Success, or Ripple Effects, or Life Skills by Botvan, there are tons of programs, Caring School Community, that can be used at that level. Ovaeus bullying prevention is another new one coming to West Virginia. And so there are tons that can be implemented by the school. It's typically implemented in a classroom setting by teachers. So tier 2 is the early intervention set, and you'll see on here it's targeted. And what that means is that you're targeting a specific need. You're not targeting students, you're targeting a specific need. So it's early intervention. We have fun calling this our coping skill level of intervention. This is where you're building skills, you're building resilience. This is not therapy. It's not intended to be therapy. Really popular across the state this year is vaping early intervention for students who get caught vaping. We're trying to find something evidence-based to work there. But you can think about it as in a school setting, schools will often already have something in place, such as, after school tutoring or recovery programming for students who are behind in credits. This just references more of the social emotional piece or more of a mental health piece, such as, coping for anxiety or grief or low self-esteem, poor communication, things of that nature. So that is most of the students, let's see, in that range, 5 to 15% of students are successful at that range. However, there's a small segment of students who will not be successful at universal and early intervention tiers, and they will need intensive treatment. And these are our high risk or high need students. If you are in a school setting, you may well know who those students are in your classes and in your halls. And they will need intensive supports to be successful in the school environment. And so that level is typically known as therapy on site at a school by a qualified mental health provider. And in some cases, it can also be a medically intensive need and or behaviorally intensive need. And that's where we have positive behavior supports come in place with individualized education plans and things of that nature. So hopefully that's clear. If you have questions, feel free to ask. It is a shared responsibility. ESMH is a shared responsibility between schools and community providers. We partner to bring in programming and supports and resources that are appropriate to the needs of that student body in that school. Okay, I'll go into that more later. We do require for the framework use of evidence-based programming. If you're going to bring something in, you may as well do something that works. And it does involve some teamwork on the part of everyone. We also address that critical link between academic success and mental health. We know for a fact that if a student is hungry or if they have something traumatic going on, it's very hard to concentrate on math and English, social studies, things like that, when your mind is elsewhere. As adults, we experience that as well. Okay. So expanded school mental health also requires meaningful involvement of parents and youth, right? So, you don't just cure one aspect of a person's life. You support them in all aspects. So think about it as far as family intervention, overall wellness. We like to look at the whole picture rather than focusing on therapy only. And that's why it's expanded school mental health rather than therapy in a school. Okay. These are some folks we collaborate with: suicide prevention, substance abuse prevention, and that is taken from SAMHSA, which is the Substance Abuse Mental Health Services Administration at the national level. We also sometimes use the term substance use disorder when we're speaking about family challenges or community challenges. We work with regional youth service centers, family resource networks, behavioral health providers, and the list goes on. You can see through here, we also have strong connections with other grantees for other projects and mobile crisis units. Here are some examples of West Virginia Department of Education policy that supports integration. Expanded school mental health is written into these, and I'm aware that some of these numbers will be changing or have changed. So we're going to need to update this. And we also look at continuous quality improvement, which is, making the process better and making sure that the school gets what they need while also meeting the needs of their students and helping the mental health providers maintain their responsibilities. All right, where are the locations of expanded school mental health grants? This is a question, Barb, that I saw that you asked, and that was pretty evident in the needs portion of this presentation. So here they are. We currently have 92 granted school sites in 30 counties across all Bureau for Behavioral Health regions. And when you see BBHHF, that probably, that's a state acronym. It's a West Virginia Department of Health and Human Resources, Bureau for Behavioral Health and Health Facilities. And they have 6 regions across the state, as you can see on the map. Their grants in the white dots that's the number of schools in that county that have a grant. And their grants are not nearly as financially large as the red dots, which are the federal AWARE grants. And those are 5-year grants in the red dots. And that's the number of locations. As you'll see, AWARE targets 3 schools per county, and they do a very intensive job of coordinating services and getting folks into care there. So the next slide I'm going to show you, it's available on the website. I'm going to kind of breeze through these without giving a big look. This map is also available on www.wvesmh.org, as you'll see in the lower right-hand corner. And it's on the About Us or Get Connected page. So this is just a quick look. These schools, there are more being added all the time, and there are some that are consolidated, so their names may change and things of that nature. But here's what we have currently. As I said, there are 92. So it's a long list. And Barb, I know you're recording this, so this will be up on the website on Inspiring Dreams Network and also on wvesmh.org/about if you need to go there and look.
It will be under our spotlight section on Inspiring Dreams Network. So you can access it at any time or share it with others.
Great. And so why do we do expanded school mental health? And is that the cutest picture ever? Okay. So here are the advantages of mental health in schools. Greater access to all youth mental health promotion and prevention. So all students in a school will have access to these services. Some of them will need the tier 2 level, and some of them might need therapy in a school also, and that's okay. The goal is to keep them in school and to enable caregivers to work without having to miss work to take their students to and from appointments. And so that's bullet point number 2. What we find is that it's way more successful to meet students and families where they're at on a natural, organic level than it is to try to pull them out of that environment to get them to appointments. Because what we find is that when I had students coming to me for therapy, they didn't go back to school. So if we can offer therapy and care in a school setting, then, hopefully we have less days missed, and the adults in their lives can, remain at work and take care of needs without having to miss their work. So greater generalizability of interventions to the child's context. And what that means is that we can do a needs assessment, look at data, and determine what do these students need from the student point of view and from the school point of view, and then you can match or tailor interventions to meet those needs. I could go into that for a long time. I'm going to leave that there. If we have questions, we can go back to that. The school also tends to be a less threatening environment, and while there is some stigma with getting mental health treatment, what we find is that when it is truly integrated into the school environment, that therapist, those case managers, those social workers, the helpers, they just become a regular part of the school day, and students know they can count on them and rely upon them um, for their mental health needs if they need it, and also for other supports. So within their social context, I know that a lot of these programs do, as Barb and I were discussing before we started that there are a lot of self-care and social opportunities within these programs, and it is dependent upon how the school approaches it and how the students approach it as well, and how the provider gets involved. So a lot of family nights, self-care opportunities, sometimes fun. I've seen folks set up tables at basketball games and say, hey, we're here to talk about anything that you want to talk about. If you're having a challenge, then here are some resources to help you meet those needs. Clinical efficiency and productivity on the part of the mental health provider, the center, if you will, that provides a therapist. You have way less no-show at a school environment. So it helps boost that productivity and helps you be efficient so that you don't have as much downtime, and that you can financially sustain a position. And in that vein, it's also cost effective. So we have greater potential to impact the learning environment and to work with teachers and educators to figure out how do we help support your educational outcomes through supporting the mental health of your and wellness of your students. All right. What do we see? What do we typically see with expanded school mental health when it is implemented with fidelity and folks have ongoing flexibility in their program to meet student and teacher needs? We see improved academic achievement. We see improved attendance, or at least not a loss of attendance when a student has to leave for an appointment. We don't miss those days. We see behavioral improvement, and we see improved graduation rates. These are linked to schools and expanded school mental health programs that implement evidence-based programming. If you don't use an evidence-based program, I'm going to tell you your outcomes won't be as strong. It's that simple. Okay. I do have a few minutes, and Barb talked about this. Before I go into the background, let me go back to this for a second. Before I go into the background, I want to say that when we're talking about tier 2 and we're talking about those supports that here, they typically are determined by data that's collected from the school. So our team starts out by doing an interview with a school team. And that school team could be your typical school leadership team, a wellness team. It could be anyone that is a go-getter, has decision-making ability. So you think about your natural school leaders. There are, to be honest, we don't require any particular standing in a school to be a part of a team that wants to make a change, right? But typically your administrators will get those folks together and we'll interview them and say, okay, tell me what's great about your school. Tell me what your needs are. And we just talk for a while and we make a list, and then we look at data and we say, wow, you have really strong this. Here's what you could do to strengthen it, or here's what you could do to meet the needs of your students. And we help develop programming based on those needs, and we help develop a strategic plan based on those needs. That targeted level of intervention can literally be almost anything that's needed to support a student. And sometimes at the universal level, schools will talk about staff training and staff support. So I did want to put that in there because we do and we can offer trainings and or hire speakers to help staff trainings too. And we do that a lot with Barb and through the West Virginia ACEs Coalition and Inspiring Dreams Network, and other folks that partner with us like Mission West Virginia to offer trainings, West Virginia Prevent Suicide, to offer trainings to the staff in a school. So that's a possibility as well. All right. Do we have any questions on that piece? I'm going to go ahead and go to the history and touch it briefly, and then we'll do Q&A. So the history of expanded school mental health. As Barb had mentioned, we started it in 2006. I was a therapist in a school, baby person in a school at that time. So I wasn't around at the beginning when that started. However, I was pleased to join them in 2007, 2008, when they started forming their state steering team. By 2009, I was actually working with the Bureau for Behavioral Health and partnering with Barb to help develop the programming for the 7 planning grants. And today, as you can see, there are a ton of grants across the state. We have a statewide steering team that represents 30 plus members with over 20 unique partners. And we do have folks that step in and out as consultants, parent advocates, partners that step in and out to help us better refine our state level work, as well as we have national partners help us do that too. So important to note that this started as a partnership. Expanded School Mental Health existed because the West Virginia DHHR, Bureau for Behavioral Health, the Department of Education, where Barb worked, and the Marshall University School Health Technical Assistance Center, where I currently work, started a conversation, and they went to other states and they said, wow, we really need to be able to better support our schools, our students, and our providers in West Virginia and our families to meet the needs of these families and communities. So that's how it got started. It seems like 17 years ago, Bar. That's a long time, but a lot has been accomplished. It's amazing, and I'm very proud of what these sites and these folks have accomplished over the years. And I'm looking forward to many, many new sites as we move forward. All right. Okay, the infrastructure. As you can see, our state level steering team is currently co-chaired by the Department of Ed and the Bureau for Behavioral Health, and I facilitate it. That's my one of my main jobs. Some of our stakeholders, like I said, are parent advocates. We have positive behavior supports. We have PBIS, positive behavior interventions and supports. We have CEOs of healthcare centers. We have, honestly, West Virginia Prevent Suicide, School-Based Health Alliance. We have a really good partnership with school-based health centers across the state, some of whom are implementing mental health supports as well. We have a lot of tools and resources on the website, and that's again, wvesmh.org. We are updating those, and we have a whole new series coming out of toolkits and videos that will be coming out between now and 2024. We do professional development. We do trainings on site, conference strands, and obviously webinars. And of course, we advocate at the state level and with legislature for expanded school mental health programs. All right, there's our website with our cute young man in there. And this is me. One thing I did want to mention is that through the website, if you go to the current events portion of the website, you will actually see that we offer a lot of trainings, some of them with free CEUs, some of them do not have CEs, but we have a lot of trainings and news articles that come up in there. If you are interested in those trainings, our newsletter, you're welcome to sign up for our newsletter. I can post a QR code for that or you can email me. That's great. I can sign you up. It comes out once a month. We don't spam folks, but it is the only way to get the free CEs for the ethics and some of the other webinars that we offer. All right, Barb, I think that's me. We still have about 8 minutes left for questions. So I'll stop sharing.
So Tiffany and I know ESMH inside, outwards, and backwards. And so when we're talking about it, we think it makes sense to everyone else. So it may or may not. So please, this is your opportunity to ask questions about school mental health. And Teresa, I know you joined us late, and one of the questions that I wanted Tiffany to answer was, where can we find it in schools? And she has a map indicating the counties that it's in and the schools. So if you have any questions about in your particular county, you can ask her about that. So what questions do you have?
Hi, this is Teresa. Can you hear me?
Hi, Teresa.
Hey, yeah, I'm sorry had to join in late. But you may have mentioned this, but is there a specific bullying type program already in the schools? I have Cabell, Mason, Mingo, Wayne, Lincoln, and Logan.
Okay, great. So there are multiple programs that will hit that. However, right now there's a unique opportunity in West Virginia due to legislation for Oveus bullying prevention. And if you Google Oveus, but actually it's funny because I just had this same request from Mineral County. So let me just pop the website into chat. Right now, granted sites through either AWARE program or through Expanded School Mental Health have opportunity to get this for free for their schools. If you are not a granted site, Teresa, and that's okay if they're not, then all I have to do is we will have to have a conversation with the state and say, is it okay if we pay for and train your folks? And they have not said no so far. We are limited on how many schools that we can take into the cohorts and we definitely have a cutoff date of September 1 to pay for it. However, it comes with 1 year of follow-up support. So if I'm your trainer, it comes with monthly coaching calls and things of that nature. And how Oveus works is you actually go in and you train a school team to train the rest of your school. So it's sustainable because if you have turnover, your school team would actually be the trainers for the program for all of your folks in your school. So it's kind of like you're your own boss, and we're there to support you, if that makes any sense. And the payment of it is a 3-year e-subscription online, and you can check out the program there. That is probably the primary bullying prevention program we have right now. And it's also early intervention, and it has a parent component as well. And some teachers love it because it's very scripted and it makes it real easy to know what to say and what not to say. And then we have some schools that are like, wow, that's way too involved. We can't get on board with that. Just be honest with the answer. Teresa, does that answer your question?
Yep, thank you. Yeah, I'll get on there and check that out. I think maybe someone from Mission, West Virginia was recently certified. I can't think of her name.
Autumn. Yeah, we have we provisionally certified 13, and that includes myself and my coworker, my teammate who's in charge of AWARE. We have the 2 lead people in suicide prevention in the state that are provisionally certified, and we also have 9 others that are in through some of them are in substance use prevention, some of them are Mission West Virginia folks. It depends. We approved 13. You have to go through an application process, so they didn't just accept anyone. You had to be tied to a school or be working in school environment to get that. So yep, you're correct.
Okay, thank you. Yeah, I did watch her webinar recently that she did on that bullying prevention. I thought it was really good. So
That's great.
Valley Health, I'm the Adolescent Health Initiative Coordinator. There's 8 of us in the state. I don't know if you're aware of that, but yeah, so that's what I do. And so yeah, I just wanted to see if there was some kind of bullying prevention program that I could get involved with or whatever. So thank you.
You can, and it's a pleasure to meet you. I look forward to hearing from you. There are a lot of things you could get involved in. we love our medical providers.
Great, thank you.
Tiffany, I know we're getting towards the end of our time. You all have put together a great resource on evidence-based programs that address various topics like bullying, suicide prevention, attendance improvement programs, so on and so forth. How would they access that?
If you want more information on evidence, okay, let me answer that with 2 answers, Barb. So first of all, the state of West Virginia is developing an evidence-based program clearinghouse. So it will look the same as the old National Registry of Evidence-Based Programs through SAMHSA. It will look like What Works Clearinghouse, CASTLE, California Evidence-Based Program Clearinghouse. West Virginia is developing their own. It is currently in approval, and a lot of folks are doing reviews right now. But like I said, it's currently in the approval process through DHHR Communications. They're the sponsors of that initiative. When that unveils, anyone will be able to go on and search for a program using certain search features to figure out what fits your school or what fits your community or even your family. Some of them are family oriented, and you can choose that. The other answer to that question is on esmh.org. We do have lists of approved programs, and it's under, I believe, resources, the resources tab. But if you have trouble finding it, just email me. I'll put my email in chat again so that everybody can have it. And I'm happy to work with you to say, okay, like Teresa did, hey, this is our need. What programs do you have available right now? And so I'm happy to do that for you and with you if you need the assistance. But yeah, we do have some on our website. We have multiple resources on our resource page, and we also have resources on our Expanded School Mental Health model page on the website. The model page is typically for schools and folks who are in the schools to implement. Like I see we have Linda Beveridge here. She's going to know what I'm talking about. And then the resources page is for anyone who wants to get started or just wants to learn more about Expanded School Mental Health. Long answer.
Okay, well, we're kind of at the end of our time. So what I'm going to do is I'm going to stop recording and see if we have any final off-camera request.
Okay. Thanks, Barb. Thanks for the time.